Hello, I'm recording this on September 15, 2010 for my students in Public Administration 5322. We're in Module 3 and Chapter 3, and I'm working from the speaking notes that are available to you on our website. There will be a writing assignment that I plan to post this afternoon on the website under Module 3. This Chapter 3 is a continuation of the explanation by the authors of our textbook of evidence-based management. They are passionate about this and are continuing to make the case that this is the way that modern healthcare organizations should be managed by the board, by the executive administrator, and other leaders. As you read our textbook, you may want to create a list of acronyms, and some of them are pretty unusual. You'll save yourself a lot of time and uncertainty if you keep a list of acronyms that the authors use, because some of them I don't think are widely used. The more I read of this evidence-based management, the more convinced I am that this is a modern version of scientific management. It is thankfully much more enlightened and, in my opinion, much better than the scientific management originated by Frederick Taylor and others in the early part of the 20th century, the early 1900s. It is a scientific management grounded in evidence of what works and what doesn't work. And as I believe I said a week ago, it seems to be evident most in the healthcare literature because it is apparently a derivative of clinically based evidence-based clinical practices. In other words, doctors responding to patients' needs based upon their knowledge of the research literature. This is managers managing organizations based upon what the research indicates makes healthcare organizations effective and efficient in doing what they do. The one overlap that I see, and I'm not necessarily criticizing those who are supporting evidence-based management, but just noting that, like Frederick Taylor, a part of the package is that creating financial incentives for team members to work along with these changes helps them cope with the natural resistance that we all have to change. That is shared in common with Frederick Taylor, whose scientific management was in part grounded in the idea that in order to get others to do what you want them to do, creating a system of financial incentives and appealing to employees' what can I say? The financial incentives help people get past their resistance to change. Other than that, I think this evidence-based management is substantially different, that it is tailored, no pun intended, to the information age, whereas the original scientific management was tailored to the industrial age. And so evidence-based management assumes that the teams that you are trying to help move to this new way of doing things are professionals, and that the way to get the teams to pull together is by appealing to the best in them, their professionalism, their intelligence, their abilities, and their understanding of why it is in their interests for the organization as a whole to be successful. The challenge of executive leadership today is not to create and maintain a structure based upon authority, command and control, as they say in the military, but rather to create and maintain a culture in which people do what is needed because they want to do these things. And if executives and other managers can create that alignment and can support the culture that produces those values and behaviors, then they are successful. The old way of doing things, the hierarchy, was premised upon notions such as the span of control. In other words, how many subordinates can one supervisor effectively supervise? In the modern age, the constraints are not the same as they have been in the past, in part because of modern information technology. I think now the constraining factor is not span of control, but is rather what Herbert Simon referred to many times as our bounded rationality, which was his way of saying that we all have limited cognitive abilities. Which is not to say that people are not smart. It's just to say that we cannot infinitely scale up our ability to know and our ability to process incoming information. And for that reason, we need the hierarchy. Not so much for reason of the constraint of span of control, not so much simply as a set of chains of command such that the organization does what the person or persons at the very top want done. It's different now. It's about professionals with real intelligence throughout the organization working together to achieve the needs of the organization without the need for centralized orders, centralized authority, although there is still some need of that. One of the early theorists, management theorists, Mary Parker Follett, was way ahead of her time when she wrote that what should interest us is not who's the boss and who's the subordinate, but what should interest us is the situation that we face together and how we're going to address it. In other words, how will we coordinate our efforts in light of the reality we face? And in the day in which she wrote a number of years ago, that was quite revolutionary because the paradigm was always defined in terms of who's the boss and therefore whose orders must be followed by others. I need to watch the time here because of the constraints imposed by YouTube. Even though they went to 15 minutes recently, I'm going to stick with their 10-minute limit and start a new video now. Please continue to watch this on the coming video.